When assessing body composition, you will be measuring 7 different skin fold sites. Some key notes to keep in mind are that all measurements should be taken on the right side of the body. Make sure the client's skin is dry and lotion free. Locate and mark all sites before measurement. Hold the caliper in your right hand with the dial facing up. Record the skin fold measurements to the nearest 0.5 millimeters for 1 to 2 seconds. And record a minimum of 2 measurements at each site. If measurements are not within 2 millimeters of each other, go ahead and record a third measurement and take the average of the two closest numbers. Record measurements in rotational order to allow the skin to regain its thickness. And finally, calculate the average of each skin fold site. For the tricep site, measure the distance from the acromion to the olecranon process and mark the halfway point with an X. After, obtain a vertical pinch 1 centimeter above the pinch site and pinch right on your mark for 1 to 2 seconds and release. Make sure you hold the pinch for the entire duration of the measurement. Once you've done that, have your client put their arm behind their back so that you can measure the subscapular region. Locate the inferior angle of the scapula and measure 2 centimeters below and mark your X. The client can then relax their arm to the side. Obtain a diagonal fold 1 centimeter above the site, pinch on your mark for 1 to 2 seconds, and release. For the suprailiac site, locate your client's hip bone or have them pointed out to you and mark your X superior to that. Obtain a diagonal fold and hold the pinch for 1 to 2 seconds and release. Next, for the chest site, measure the distance between the anterior axillary line and the nipple. For men, mark your X 1/2 of this distance, and for women, mark your X 1/3 of this distance. Obtain a diagonal pinch, obtain your reading, and release. For the middle axillary site, have your client raise or move their arm back. The middle axillary line should be level with the client's xiphoid process of the sternum. Mark your spot with an X. Obtain a vertical pinch and record your measurement for about 1 to 2 seconds and release. For the abdominal site, measure 2 centimeters or an inch to the right of the client's umbilicus and mark your spot with an X. Come in with a vertical fold. Obtain your reading and release. The final site will be the thigh. Make sure your client's weight is shifted onto the left leg and mark your X on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease. Obtain a vertical fold. Record your reading for 1 to 2 seconds and release. The accuracy of estimating body fat using skin fold measurements is plus or minus 3.5%, assuming that proper technique and the correct regression equation is used. The following are the most common and general equations used to calculate body density for a wide range of individuals. Population-specific equations are also available and may provide a more accurate estimate of body density and body fat.